Okay, so this is the quadruped position, as you can see, and I'm going to talk about just kind of the static posture that we're looking for, and then I'll have her rock backwards and rock forward, and then I'll also have her do the shoulder all on this one, being that they all go fairly quick. So, as you can see, starting at the feet, the dorsum of the foot should be close to touching the table. If they can't do that, right, we're thinking that she can't plantar flex, so the dorsiflexors are probably tight. Right, she can do that fine. And then the knee should be directly under the hip. The hip should be flexed about 90 degrees. So you have a 90-degree angle here at the hip, 90-degree angle here at the knee, and then a 90-degree angle here at the shoulder with the wrist under the shoulder. Yep, so she's in a good position, and then her head's just looking straight down. And this is kind of hard to see, but I want to talk you through some of the dysfunctions, okay? So what we're looking for is the lumbar spine actually to be flat in this position. We don't want a lordosis or an excessive lordosis. We want it to be flat. If it's excessively lordotic and they have pain, sometimes you can tell them to use their abs to cause a little bit of a posterior tilt to neutralize that curve, okay? Talking just a little bit about the shoulder blades, and you guys have probably seen this on the quiz that's on Blackboard, but the shoulder blades should be about 3 inches away from the spine. So that medial border of the scapula should be 3 inches away from the spine on both sides. If it's greater than 3 inches away, we're thinking that the adductors of the scapula, okay, so let's imagine you're looking from the top down, okay, and you have her shoulder blades, okay. Spine is this white piece on my shirt. These are the shoulder blades. We want them to be 3 inches from like the medial border, which we'll call my thumbs. If they're abducted, we're thinking that the adductors or retractors, the rhomboids and the traps are going to be long and or weak. And if they're abducted, we're thinking serratus anterior is probably going to be short. I'm not going to get into too much depth there because that's more the upper quarter, but we are going to talk about scapular alignment a little bit here. So again, if there's abduction, serratus anterior is probably going to be short. And if serratus anterior is short and there's more than 3 inches between the vertebra, we're thinking rhomboids and traps are going to be long. Okay? One last thing about positioning of the scapula. We know that the superior medial angle is about T2, and we know that the inferior angle is about T7. So the scapula should be sitting between about T2 to T7 on both sides. Reference point as you're observing both in standing and in quadruped. The neck, we don't want her into a ton of extension, so if she can't go into neutral, we're thinking that the levator scapula is probably going to be short, pulling her into that extension. And sometimes you can have one unilateral levator scapular pulling her into extension. So the cervical spine should be neutral, no bulging of the levator scapula. Quick screen of the scapula should be between T2 and T7, and then the hip alignment should be here. Okay. So what we're going to have her do, I'm just going to have her rock back towards her heels as far as she can. And her comment was, I kind of have to bring my legs out a little bit further in order to do this, okay? So she's going to come back up. And what we're looking for is, from this angle, are her femurs staying perpendicular? Or are they rotating or abducting? Okay? So we want to look at, do the hips actually flex? Right? Do we get that 120 degrees of hip flexion? Or is there a ton of lumbar spine flexion? So let's say she comes back, and little crack there, but she gets pretty good hip flexion, and we know that from the unilateral test, and her lumbar spine stays flat, and that's normal, that's what we want. If we have an excessive lumbar curve here, let's say she stops here, come up to about here, let's say she stops here, and then her spine is so rounded here, we're thinking that the hip extensors are so short or stiff that she can't flex anymore, So then she gives that her lumbar spine, and her lumbar spine flexes. If our lumbar spine flexes, we're thinking the lumbar paraspinals are long, and the abdominals on this side would be short, basically flexing that spine or causing her to go into a posterior pelvic tilt. Okay, go ahead and go back to neutral. So another thing we're looking for is rotation of the spine when she goes back. Are you doing okay?
Yep.
So as she goes back, is there a rotation or an elevation of one side or the other? So if she comes back and let's say her left side elevates, basically as her left side elevates, so go ahead and come back, if this side elevates, it's because she can't flex. So she's cheating by this side staying up, basically causes an abduction lateral rotation at the femur. So if you're abducting and laterally rotating at the femur, you can come up. If you're abducting and laterally rotating at the femur, we know that glute max, which is an external rotator, is probably stiff or short. And we know that piriformis is probably contributing because it's causing it to abduct a little bit. And being that she's fixed here, the reverse action is this pelvis or this side that's limited is going to stay higher than the other side that's normal. Okay? So that could be some dysfunctions that you're looking at. Alright, so a couple more here. I'm going to have her kind of scoot her hands out a little bit. And basically we're going to have her do, I don't know, is this called the cobra? We're going to have her kind of fall down. Is that okay? So again, remember with individuals that are pregnant, their joints are lax. So I won't keep her here long, but we're looking for a uniform curve. Go ahead and get out of that position. So much like we've talked about in the SFMA, is it a uniform curve or do they hinge or shear? If they hinge or shear, it's probably because the hip flexors again are short or stiff, which cause that anterior tilt. The lumbar spine is flexible, which then causes it to hinge at that joint. Okay, so that's what we want to look at there. Last but not least is we're going to have her left arm up towards the ceiling, leading with her thumb. Oops, sorry. Nope. So we're going to have her come up this way and back down. We're going to have her do the same with the right. And really what I'm looking at in the lower quarter is there a rotation at the pelvis? So go ahead and do that a couple more times. Is her pelvis rotating? If it is, it's telling us that her abdominal muscles are not controlling the pelvis to keep it stable. So we want to cue her to do that, but she looks good there. And we don't want rotation to occur in this position. We want her to stay stable. So the thoracic spine or the lumbar spine, we do not want to rotate. Okay? So those are the quadruped tests in alignment. Sorry, that one got a little lengthy, but we just covered all the quadruped tests.